Hello everybody, this is Dr. Kevin Connors. I want to talk to you briefly about a new product that we carry called OrthoMune. OrthoMune is a product from Orthomolecular Products in Wisconsin. Great company. They highly test their ingredients and they only use the best ingredients. Just a professional line all around, and they are a great company to work with. Excited about this product in general because of why it was created and for what it was created. It is a great immune, hence the name OrthoMune, stimulant. It's an immune stimulant specifically for the lungs and the chest and the bronchi, the respiratory system. And it's a great product to decrease inflammation, especially from a respiratory virus. So respiratory viruses, bacteria, cause mucus formation, inflammation, and that's really what causes the dysfunction and the bodily distress is all that inflammation because of that response to that virus. You've heard it said that respiratory viruses, especially the one that we're dealing with in society today, are causing breathing issues, causing all sorts of lung congestion and problems, pneumonia-like symptoms without it being pneumonia. And that's what's causing the morbidity that we're seeing. So we need a product that is going to help balance that out while stimulating an immune response, T-cell macrophages, to be able to kill the virus itself. So that's what this product was created for. It was really formulated based upon what the frontline doctors are recommending for this virus. Vitamin C, vitamin D, zinc, N-Acetyl Cysteine, and Quercetin. So they all work together synergistically to help specifically with viruses that affect the lungs, the bronchial tubes, and the brain as well. So it's a great product to put together. Let's talk about why we use these things. Quercetin is an anti-inflammatory product. It's also a product that decreases the cytokines. Those are the chemical storm cytokines, the inflammatory cytokines that block the immune system's ability to kill the virus. So it's a great anti-inflammatory. It's also a great antioxidant agent. So an oxidizing agent in your body is something that can actually cause a lot of disease. Oxidation can break down the cell membrane, can cause viruses to get in the cell membrane, and could cause disease in the cell and even cancer. So you have an antioxidant system in your body. That's one of the other components in this product is N-Acetyl Cysteine. N-Acetyl Cysteine is a precursor for glutathione, which is your main intracellular antioxidant. So your mitochondria, as well as all your organelles in the cell, rely on glutathione to get rid of oxidizing agents within the cell. So glutathione is recycled in the cell. It's oxidized, reduced, and recycled, and it relies on its components. N-Acetyl Cysteine is your main component of glutathione to recycle more quickly, and to help with the oxidative stress that's inside the cell. That's what's taking place when a virus does get inside the cell, is oxidation. And that's what damages the cell, causes inflammation, causes that increase in inflammatory cytokines that go outside the cell and causes that inflammation that gives you the symptoms of a viral infection. So when you have those blocked lungs, the inflammation in the lungs, you can't breathe anymore, fluid in the lungs, that's from inflammatory cytokines that are not getting broken down inside the cell, hence the need for N-Acetyl Cysteine to produce more glutathione to get rid of those things. Quercetin, again, like I said, is a great antioxidant, and it's a great anti-inflammatory of these pro-inflammatory cytokines. So it helps reduce them outside of the cell, whereas glutathione works inside the cell. Quercetin works outside the cell. There's also studies that show quercetin blocks a viral transmission into the cell. So remember, viruses, when you're exposed to them, they do you really very little harm until they get inside the cell and start reproducing. Viruses really aren't living organisms. They can't live on their own like a bacteria can. But they need a host's cell in order to reproduce. So they have to enter through into the body. You're breathed on, you receive this virus, you breathe it into your tissues, and if it stays in the extracellular spaces between the cells, your macrophages and T cells will gobble it up, and you'll never have any symptoms, hence you didn't get sick. In order for you to get sick from the virus, it has to cross the cell membrane, get inside the cell, and start replicating. That's the need for glutathione, if that happens, inside the cell to drop down the oxidative stress that's going on inside the cell with a replicating virus. But if you can keep it from, or the majority of them, from getting inside the cell, then you won't get sick. Hence, quercetin comes in. Quercetin is a great thing to block a virus's ability to get inside the cell. So quercetin is a multi-faceted warrior. It decreases inflammation in those inflammatory cytokines. If inflammation is taking place, it's decreasing those. It's decreasing the ability for a virus to enter inside the cell, helping it stay outside the cell where your macrophages and T cells can gobble it up and destroy it. And it's also decreasing oxidative stress. So it's a great warrior. And acetylcysteine, as I said, is increasing what's inside the cell to produce more glutathione and help if there is an infection inside the cell. And then you have vitamin C in this product. Vitamin C is for decades known as an immune stimulant, also as an antioxidant. So it decreases oxidative stress both in and outside of the cell. It's an immune stimulant. Numerous studies show that it attaches to macrophages and T cells, helps those cells become more active and be able to help attack viruses and bacteria better. Same thing with vitamin D, works the same way. It's an immune stimulant. It helps the T cells and macrophages basically become empowered to be able to fight an infection. Key component to any immune system function is higher levels of vitamin D. Numerous studies have shown people with suppressed vitamin D levels are going to be more susceptible to viruses and bacteria. So keeping the vitamin D level up, combining these together is key. You've heard over and over about the benefits of zinc with viral infections, especially respiratory viral infections. Zinc is key. And what OrthoMolecular did is they put a good form of zinc in this product, a Trax form of zinc. You see it on the label, meaning it's going to be readily absorbed, readily used by the cell. You take it in combination with quercetin and N-acetylcysteine, it's going to get inside the cell and stimulate an immune response to be able to fight any viral infection. It is truly the synergy of this product that makes it work well. Now, you can take all these things individually. I'm going to take a vitamin C tablet. I'm going to take my D. I'm going to take my zinc. I'm going to take my N-acetylcysteine and my quercetin. But that's 5 different things that you need to take. The reason why I love this product is they put it together. You're taking it all at the same time. The synergy of it working together, the ease of taking it is a huge benefit. It's a great product. We recommend, just as the label says here, 2 capsules a day. I recommend that you split it up into 2 doses, 1 in the morning, 1 in the evening, because everything that you consume has a half-life in your body. You want your body to be dosed with this. Sometimes it's even good to hyperdose to begin with. Take double the dose to begin with for a month, and then drop it down to a standard dose of 1 in the morning, 1 in the evening. If you feel like you're coming down with something, you feel a little feverish, you feel like you've been exposed to any sort of virus, it's good to double or triple the dose to keep your immune system primed, to keep as healthy as possible. A great product, easy to take, all together in one thing. It's been a big hit for our patients. You can find this product at our store. Comes in a bottle of 120 capsules. So on a normal, I'm healthy, I'm just dosing this for preventative, it'll last you a couple of months. So it's an easy product, inexpensive product to take. Very simple. Find it at shop.connorsclinic.com/OrthoMune. Thanks so much. Hopefully this video was helpful and it can be a blessing to you and your family. Bye-bye.